Hi, I'm here with Dr. Friedman, AARM Executive Director and speaker at the Restorative Medicine Conference in Tucson, Arizona this fall, where he'll be speaking on the topic of adjunctive treatments for multiple sclerosis. Multiple sclerosis is a condition which has really evaded effective pharmacological treatments. Would you say there's a lot of research going on in the field? And what is the current success rate for pharmaceutical treatments at this time?
So there's different types of multiple sclerosis. There's called relapsing remitting, and there's primary progressive and secondary progressive. So far, most of the drugs, there have been actually no effective drugs for primary progressive. Until recently, a new drug just came out for a monoclonal antibody for the treatment of primary MS, and it's actually been quite effective. It has a modest result, but it has some effect. And it's actually a drug which has been used for lymphoma and leukemia. It wipes out the B cells, and in that process decreases the autoimmune aspect of the illness. Most of the research has always been on T cells, but recently they found nowadays that it's not just T cells, it's also the B cells which are affected in multiple sclerosis. And that's why this new drug has been useful for primary, but it's also been useful in relapsing remitting. And it just came out within the last 6 months, and it's kind of an exciting new pharmacological treatment.
And what are the most common side effects a patient can expect to experience with these pharmacological treatments?
Well, the monoclonal antibody therapy, it suppresses all the B cells, not just the B cells for MS. So it causes immune suppression. So the person is immunocompromised, and the risks are going to be serious respiratory infections, urinary infections, and so on.
It sounds like medications are really more of a disease-modifying therapy rather than an actual cure. With such low expectations of really halting progression of the disease, does this mean that many patients end up looking for integrative medical treatments as alternatives?
Just as with a lot of illnesses where there isn't clear cures or highly curative or highly effective treatments which stops the illness, alternative medicine and complementary medicine is used a lot by patients. It depends on what study you look at, but it varies between 30 to 80% of patients who have multiple sclerosis will look for integrated therapies.
And what are the basic tenets for restorative medicine for treating multiple sclerosis? And what are the exact treatments that you're using for your patients?
Well, we will look at it in a similar perspective in the sense that we look at immunomodulation, but we look at other therapies which help with immunomodulation, and we look at it more from a root cause, or what's causing the immune balance. So we might modulate the immune system by, rather than suppressing it, more by balancing it. So we will still look at the things which will help B cells and T cells, such as looking at the microbiome, looking at the, personally I even use, I recommend some of the same herbs for multiple sclerosis as I do with lymphoma by helping the B cells and the T cells. But I also look at other things such as antioxidants in the brain, neuroprotection. I look at also hormones. For example, thyroid hormones like T3 is actually an essential hormone in myelination. Also, testosterone levels are often low in multiple sclerosis patients, and that can help significantly with depth perception, spatial relationships, and a sense of well-being. Hormones such as estrogen have been used because estrogen is a neuroprotective hormone which also decreases the effects of multiple sclerosis. And that's why a lot of patients who have, like for example, who are pregnant, will go in complete remission while they have MS due to the high levels of estrogen, but yet they're more prone to a relapse after the pregnancy is over when the hormones start going down. So we look at hormones. We'll also look at nutrition, look at nutritional cofactors which help the myelin sheath.
And what can restorative medicine practitioners bring to the table for treating MS? Is that significantly different than what neurologists are doing?
So restorative medicine is going to look at the root cause. It's going to look at the immune system. It's also going to look at what happens when the immune system is affected. So when the immune system is affected, it's going to cause demyelination, but we're going to look at not only how to alter the immune system and balance it by looking at the triggers which make it go awry, but we also look at how to prevent and protect the body from the damage from the autoimmune illness. So we're looking at all the different things, not only on the root cause, but also at the secondary level of what's happened when the autoimmune disease has attacked the myelin sheath. Neurologists will not at all prescribe hormones. They will not really look at diet. They'll not look at nutrition. They'll not look at environmental factors. So we're looking at all these different things at the same time.
Your presentation focuses on MS specifically, but much of the pathophysiology of MS is really rooted in autoimmune disease and inflammation. So would you say that your protocols for treating MS could really be applied to a lot of other autoimmune conditions that practitioners could use to treat other kinds of patients?
Absolutely. For example, my focus in clinical practice was treating primarily Hashimoto's and hypothyroid autoimmune diseases, including Graves' disease. A lot of the different treatments for hypothyroid and hyperthyroid are quite similar to actually treating MS. For example, you're going to be looking at the microbiome, and you're also going to be using a lot of the same herbs and polyphenols. For example, rosmarinic acid is helpful for T-cell and B-cell apoptosis, and it's been very helpful for my patients who had hypothyroid and hyperthyroid, and I would track their antibodies, and the antibodies would go down. Rosmarinic acid in multiple sclerosis is helpful in decreasing the autoimmune aspect, but it's also helpful as a neuroprotectant. Rosmarinic acid has been able to, in animal studies, has shown a huge impact in protecting the brain and neuroprotection.
Thank you, Dr. Friedman, for being with us today. We've got a little more information about what you'll be talking about at the Restorative Medicine Conference. And by the way, that will be in Tucson, Arizona, October 5th through 8th. And if you're interested in getting more information or registering, you can go to our website, www.RestorativeMedicine.org. Thanks for being here.